Well, there are fears now that the country might see the rise of a type of virus, a respiratory virus, in the coming few days. It usually causes mild cold-like symptoms, but it can cause serious lung infections, especially in infants and people with serious medical problems. It's always concerning as we head into winter, isn't it? The NICD is saying so far this virus has been detected in at least 19% of children under the age of 5 who are hospitalized. That's very worrying, and thankfully we have an expert on this, pulmonologist Dr Emmanuel Taban from Mediclinic Midstream Hospital. Dr Taban, good morning to you. It's always so good to have you on eNCA. Before you tell me about this virus, I didn't give the name because I feel like I'm going to say it incorrectly. I have it here as an RSV. Just help me and viewers understand, what am I talking about when I say RSV?
Thank you so much, Jared, and thank you for the viewers out there. Yes, thank you. RSV, it stands for respiratory syncytial virus. It's really a virus that's been around for a number of years. And what it happened, that's actually caused mild cold. But again, as you mentioned, in children that are less than 5 years old and adult also, depends on the underlying comorbidity, can present with the serious conditions. Yes, the NICD issue warning about that the numbers have risen as compared to normal. The season for RSV actually started from February until from February to mid-March. And that's when the numbers really start going up. And in February, it was sitting 19%. Currently, around the 5th of March, it was almost 32%. Yes, so so could be a serious condition, patient with the underlying condition.
And we want to be careful here, Doctor, don't we? We want to emphasize the importance of this, but we also don't want to cause any kind of panic either. We're in the middle of COVID-19, that isn't gone. That's already confusing to understand the symptoms of COVID-19 and the normal flu or influenza. Now we have RSV. So if there's a parent watching now at home, maybe their little one has a bit of a runny nose or maybe a bit of a cough, we don't want to start having people panicking. So just put our minds at ease. How do we know the difference between the common cold, maybe flu, and this RSV, this respiratory syncytial virus? Hope I said that right.
I think the presentation is more or less the same. It's present with flu-like symptoms. That's really the most important, with cough, wheezing, tight chest. So it depends what is the predominant problem, because the most common is normal bronchiolitis. So they tend to be wheezing, and most of them is really self-limited. And then, of course, in some cases, with children less than 6 months old, could be very severe, so that they could present with pneumonia, and the oxygen level can drop. But that is really in the few percentage of the children in that particular age. But most of the children really would be like running nose, really cough, and then sometimes they feel like tight chest. And basically, I think the family don't need to panic. What you need to do is to make sure that those children are kept at home, isolated for 2-3 days while they're coughing, so that they don't go to school to reinfect other children. So otherwise, they present really is really similar to flu-like, but different from COVID. COVID is completely different presentation.
And that's what I wanted to ask you as well. As I say goodbye to you, Doctor, as well, I want you to just make that differentiation for me between COVID-19 and this respiratory syncytial virus. Because we also don't want people to start panicking, thinking they've got a runny nose and flu-like symptoms. Now they think they've got COVID-19. Can you just explain that difference between COVID-19 that we all know now and this RSV?
Yeah, COVID-19 really don't present with flu-like symptoms. Normally, no, they don't have running nose, they don't have a blocked nose. COVID-19 tend to have more shortness of breath and the short throat in most instances, and then, of course, lung involvement. Again, COVID-19 in children is never really a problem. Most of the COVID-19 will have headache. While with the virus, it's really running nose, blocked nose, sneezing, and then some bit of a tight chest, or what you call wheezing lungs. And that's how the flu-like symptom really come about. So you could distinguish them very easily, and there's no need really to go and test for COVID-19. And as with the respiratory syncytial virus, you also don't need to do really tests. We only test in the cases that are severe. But in most milder cases, as I say, it's a limited case, and it happens every season. So people should not panic, and unless really the children or adults have really underlying conditions, that's where they need to seek some help. But most of the time at home, hydrations and also staying warm And obviously for fever, you can use Panadol, and that's adequate enough.
Well, it's always great to have you, Doctor, on the show to help me understand what this is and parents watching as well. Pulmonologist Dr Emmanuel Taban from Mediclinic Midstream Hospital. I appreciate your time in explaining the difference between flu, and I hope I'm going to say it right this time, this RSV, this respiratory syncytial virus, this RSV, and that versus COVID-19. There are distinct differences. There's very, very clear differences between the three, between flu, RSV, and COVID-19. So don't panic as yet.